Welcome, everybody, to the table. Voices from the Edge. Happy Friday.
Happy Friday.
Yay. We have a full show today, and we have a full table. We have August and Maureen, Katie, Mo, Roseanne, Anitra, Keisha, Aundria, and Marley. And of course, I'm Kim Page, and we are here to talk about some really important topics today. We will have a great segment from Keisha on mental health, since this is Mental Health Day. But before we get into that, I always like to start our Friday roundtable with what is the news of kind of today, right? What happened today? Everybody knows what happened today, right? Woo! We've been hearing a lot about the Nobel Prizes that have been given out here for the last, I think, week or so now, and the Peace Prize was announced today. So the Nobel Committee said the recognition would instead go to Venezuelan opposition leader Maria Corina Machado. So Trump did not get his Nobel Peace Prize. It went to this lovely lady who has been fighting for democracy in Venezuela against the Maduro opposition. So she's definitely a well-deserved recipient of that. And so I found this is interesting. I want to show a clip of the actual committee chair who was asked a question by a reporter about the topic of Trump wanting this. So this will be kind of interesting.
Congratulations to Maria Corina Machado and the committee on the decision. But during the past months, US President Donald Trump has repeatedly said he deserves the Nobel Peace Prize and he'd like to have it. He even said that it would be an insult to the United States if he doesn't get it. What does as a chairman of the Nobel Peace Prize Committee, think of this, and how has this campaign-like activity by the president and his supporters domestically and internationally affected the deliberations and the thinking in the committee?
In the long history of the Nobel Peace Prize, I think this committee have seen any type of campaign, media attention. We receive thousands and thousands of letters every year of people wanting to say what for them leads to peace. This committee sits in a room filled with the portraits of all laureates, and that room is filled with both courage and integrity. So we base only our decision on the work and the will of Alfred Nobel.
Courage and integrity. Absolutely.
It couldn't get any better.
Something that he does not have either of.
Not. But I want to, meanwhile, back at the White House, this is what happened when Trump got the news.
Prize! Gimme! Wah! Wah! Gimme now! I want it now! I deserve it! Nobody else deserves it like me! Gimme now! Nobel Peace Prize! Or else!
We had to resurrect that one.
And he's still crying.
That's one of my favorites. I've been posting that on Blue Sky all day.
I know
that get more serendipitous than this. And watch, he say she in Trinidad Aragua or something. Watch, it's coming.
The first thought I had, even though I know it's not a real video, is not even a mother would love that baby. Like,
something happened at the house. So I think that's what happened.
We've all experienced a child like that, I'm sure.
Well, let's say it out loud. Trump did not deserve the Nobel Peace Prize. He is so far from noble that it's pathetic.
There's no peace. He's a divider in chief, not the unity. Come on now. He want one because Obama had one. He got to have everything he had.
And you know he's gonna be even more pissed that a Latina woman won.
Oh
over him.
man.
Oh,
Out of my face.
Only thing could have been worse with Letitia James. That would have ended and he'd have been like,
Yeah. Yeah, we would have seen another boat get blown up somewhere.
Mhm.
Oh my God. Yeah.
I
And
still
know
can't
right
believe he blew up those boats. I mean, just destroyed them. He doesn't know if it was, legal people or illegal. He just killed them.
now, hopefully the truth comes out, right? I can't verify, I haven't fact checked this yet, but there was something I read today. The Colombians are saying that they might have been their boat out there. So,
See, that's what I'm saying. He
I
don't know
don't know.
who he's
I
got.
can't. I haven't fact checked, so don't hold me to that. But I want to look more into that because I think it's worth covering.
Okay.
Right. Okay. So that got us started. Let me pull these here, and then I will turn it over to Keisha for Mental Health Day.
Yes, today is World Mental Health Day, and it is every October 10th. And it was started in 1992 to bring awareness to mental illness and mobilize support for mental illness care. And I wanted to share some stats about who is affected by mental illness in the United States. So, Kim, if you wouldn't mind putting up that first slide. Anyway, we can make it bigger.
What's that?
Can we make it bigger?
I don't know that I can. Yeah.
So 1 in 5 U.S. adults is affected by mental illness or experience a mental illness issue. And 1 in 20 U.S. adults experience a serious mental illness. So this is a lot of people. And then 17% of children experience a mental health disorder. And if you look at the chart on the left, the map of the United States, it's actually kind of confusing. It looks like it's breaking up the United States and dividing it by who has mental illness, what kind of mental illness where, but this is more about percentages. What I think is really striking about this is 19% of people that struggle with mental illness in the United States struggle with anxiety disorders. 19%, that is a lot. And this is from, I believe, 2021. So these numbers are probably higher in the environment that we're currently living in. The next common mental illness disorders are depression or 2 or more mental illness. So sometimes people have depression and anxiety. And I also wanted to show how the Trump administration is handling mental illness. So if we could put up that next slide. So as of September, these are the cuts that the Trump administration has made to mental health programs. So $1 billion was canceled from Biden-era school mental health grants. So when you think about all the conversations we've had about needing counseling in schools for the growing radicalization problem we have, there will be fewer programs like that because of these cuts. $1 billion in cuts to the Substance Abuse and Mental Health Services Administration. And we know that substance abuse problems are huge in this country. 10,000 people from the Health and Human Services Department were laid off. And that includes the team that oversees a survey on drug use and mental health. So we're not going to have as much access to information about these issues. And $1 trillion is expected to be reduced in federal spending on Medicaid, which will undoubtedly affect mental health. Next slide, please. And they also, in terms of research, rolled back LGBTQ and DEI-focused mental health grants. It's tragic. They also canceled grants that are primarily focused on these marginalized groups. And basically, the concerns of experts are reduced access to data may harm public health tracking. So we may not even have numbers about how many people suffer from mental illness in this country. We're not going to have providers that can focus on, or as many providers that can focus on these niche groups like Black, Hispanic, etc., LGBTQ groups. And this is going to widen access problems and equity issues. And we have a problem in this country with kids and them needing access to mental health, and reducing spending on that is not going to help our problems. So I want to open up the floor to talk about concerns about this, any experiences that people want to share with mental health issues.
So something that sticks out for me when I'm just seeing a lot of those stats is, you know, like with the people that he's cut and stuff, this is even before he cut them, people still had a huge stigma regarding mental health, even in the last like 30 years. And so like I know when you were talking about like guidance counselors at school and stuff, I can't think of schools that I know that have guidance counselors like actually doing the job of a guidance counselor, because they have to fill in and do jobs for other things, like they don't have enough secretaries, or like they're also a school nurse. And depending on like the areas you're in, some people just stand by their stigmas regarding mental health and don't think that people need it, but you do, because if you have like young men who just don't know how to deal with their mental health, that's how we got a lot of like the Andrew Tate problems. And a lot of the reason why a lot of these young men go towards the MAGAverse, because they see people that are like them, but they don't, we don't realize how dangerous it can get.
Go ahead.
Yeah, what stood out to me was you're saying I'm concerned about the money that they're taking away for mental health resources. I was diagnosed with multiple like mental health illnesses. I found I'm fortunate that I have medical insurance provided through my employer to get the mental health, help from the therapist and psychiatrist, and my medication is paid for with very low copay. I'm concerned about others and myself if for some reason I'm no longer employed. How that would affect my ability to, I don't know, stay healthy mentally and emotionally. And I think also in the time that we're living in politically, I know I've been struggling more with my mental health, just everything that's happening and what's happening with the Black community, and how I feel through the news, what they're talking about with the shootings that have been happening, how seems like they're targeting people who have mental health issues. We're more likely to be the victims than the perpetrators. This is very concerning because it adds the stigma, and I wonder if my rights will be taken away because of that. I'm worried because of how they view mental illness, how Kennedy talks about prescription drugs like they're not necessary, and they're very necessary. I'm also concerned about the Black community in general, because traditionally, I've even struggled with this with my family. My family is against going to get therapy, taking medication. And I feel like that's a part of our history as African Americans, because our ancestors dealt with so much and they didn't have to go and do therapy or take medication. So everything's very concerning. I think that even though I have the resources to get therapy, prescriptions, and see doctors, that it's even hard for me it's hard to get appointments. There's a shortage in mental health services and professionals. I specifically feel more comfortable seeing people of color. I'm fortunate to have a therapist that's African American, a psychiatrist who's African American, and a woman who's from East India. She's another therapist that I see. And it's important that people of color, you have a diversity, because the things that I need to talk about, they know, they have a shared experience in that. Um, it's just a shortage, and they're taking away money, and people need the help. And specifically, people of color, I think, really need the help right now, just based on what's happening with ICE and other things that are happening in the world today. And I don't know. That's my view on it.
Thank you for sharing that.
Yeah.
Anitra, you want to say something?
Just quickly, I'll try to make it quick. So I am a mental health worker. I work in that, like I said, and I've seen the with the mental health, the I mean, even in the hospital setting, it has its own challenges. And then what I was thinking about today, I was driving around and I was thinking, if somebody has an emergency and they're sick, we call an ambulance and an ambulance comes. But if I call an emergency because somebody's having a psychotic episode or they're having a mental breakdown or some stress in that area, they don't send an ambulance, they send the cops. And I was talking to somebody once about somebody who was having a recent psychotic break, very young person, and it was just very special person. And they said, "What do you think's going to happen to him?" And I said, "He's going to end up in jails and on the street, and in jails and on the street, and in between medicine." And now it's just going to be worse because the funding is leaving, and they're going to be hit the hardest on all fronts, SNAP benefits, all that stuff. And what she said about the Black community is true. We tend to say walk it off. I struggled with that when I was having my own issues coming up, and people not really understanding, as whispers. She's getting help, but I got help, and I'm getting help. So we're in a crisis right now, though.
Just something real quick too. People that don't know a lot about mental health meds or don't take these kinds of meds, they don't realize that you have to get weaned off of them. You can't just stop taking a medication, especially for things like personality disorders or like ADHD or things like that. You can't just say, "Oh, I don't need my Adderall or my Klonopin anymore." It's like that is even more dangerous to just quit something cold turkey, because that messes with your mind too. And when you mentioned, Anitra, about like cops showing up instead of an ambulance, when they throw people in jail like that, excuse me, like they don't have access to their medication, so who knows what they do or don't need, that can just add to it.
The problem is, Katie, is even if they don't take them to jail, they'll take them to the hospital, but they're the escort, but it adds another layer to it. But the problem is no offense to them, they don't care because nobody cares about them because the mentally ill people until it comes into their neighborhood or their house. Do they care?
Yeah.
So they say, "Oh, that grown man can work." Yeah, he could work, but his mind's not going to be right for that kind of job. But they're going to suffer because a lot of them don't have children. They're men, a lot of different things, and it's going to be bad. I hope I'm wrong.
Yeah, I have.
Yeah, Kim.
Yeah, so just want to comment. I think, Katie, yeah, the stigma and the shame around this is always a big issue. So I wonder, in your research, Keisha, how many people who don't report, right, that they're having mental health issues? Is there any kind of estimate about how many more people might be suffering from mental health who feel like they don't want to get help because of the shame, because of the stigma?
Not that I've seen, and I'm not even sure how they would be able to quantify that, but people smarter than me figure out these statistics. But no, I don't know.
Yeah,
But that's
that would
really point, because there are a lot of people that are struggling with undiagnosed mental illnesses.
Well, from my personal standpoint, I know that I didn't go and get help because I was because of the stigma. I suffered with PTSD and depression for like almost 20 years before I really had to break down to go and get help. And still, I didn't have the support around me from loved ones while I was going through that process. So if it happens to me, I'm sure it happens to a lot of other people.
Yeah, and I'm sure. Yeah, and the other thing you said, I'm sorry, Maureen, just real quick, and I'll turn it over. That our community, we have communities that are currently being traumatized, and we have a nation that's currently being traumatized. So this is only going to get worse, I'm afraid. And then how do we manage that? How do we deal with that, especially with all the cuts that are happening? So I'm sorry, Maureen, what did you have?
I have a 18-year-old niece who's in Colorado, and she's, I'm happy to say, is finally getting some help. And she has extreme anxiety, but it took a while for that to be identified. And she is on medication. And you're right, they really have to monitor that, because sometimes you have to change the medication, but it's very important. She is also going through the fact that she feels like she's trans. So you can imagine having that mixture and what's going on right now. And only, I worry about her, but I'm so happy that her mother has made sure now that she is able to get that counseling and that medication. But gosh, we're all afraid, aren't we? What's going to happen when they get cut back? Because they don't have,
They're already starting to cut back.
Yeah.
And getting on the right medications takes a long time. I think for me, it took like 5 years for me to finally just get everything put in place.
That's
They
interesting.
need to start doing more testing, and they could do that faster instead of just guessing. Don't get me started on that.
With all of the money they are taking away from mental health, they're not putting it in the grocery store for us. They're not putting it in the education for us. They're not putting it in anything for us. Our president has become a billionaire in the past 10 months. He doesn't care about us. Why should he win the Nobel Peace Prize? He doesn't care about us. We are suffering, and if we let him continue on this pace, we're gonna suffer some more.
And in my opinion, he's mentally ill.
That's right.
And let's not forget that the new premium rates are coming right now. People are getting those bills in the mail. And as we've talked about before, they're going to make a decision. Can I afford to keep my health care, or do I need to feed my family? So this crisis is just starting. The snowball is like that small, and it's going to get 500,000 times larger come the first of the year, I think.
And there's not enough room in the end for all the people who need it, and there's not enough people to take care of those people who need it.
Yes, exactly.
Because Argentina that got $20 million?
Yeah.
Who's going to take care of the people that take care of those people? Those professionals, who do they go to for help? It's just the snowball effect. That's all.
So I wanted to share some ways that you can support on this World Mental Health Day. I also wanted to share personally that I was diagnosed with depression, major depression, at 19 when I was in college. And I kind of had a breakdown my freshman year and didn't know what was going on. And my dad, who was not necessarily big on like therapy and medication, helped me get treatment. And that was life-changing. I got on medication. I started going to therapy regularly. And it was like, is this what people feel like who don't suffer with these feelings? It was like a light turned on. And it's not it's not like it's just an easy road, like once you get the right medication and treatment, because honestly, today has been a rough day for me, but I've gotten good at putting on a mask. And I say that because you never know what people are going through. People can smile through distress and pain. So this topic is really near and dear to me. I think that honestly, everyone could use therapy as just a checkup, like you go to the doctor for a physical.
Yeah.
Because
Thank you.
When you go
people
through
to talk to.
Keisha, when you go through the episodes, do they teach you to talk about it? Like you said, today has been a stressful day. Does it then at that point say maybe we should talk about it or share it with us, your friends? Or, you know, we love you.
I'm very in touch with my emotions. Like I've gotten very good at identifying what I'm feeling.
Mm-hmm.
But I will say that sometimes I'm still reticent to talk about it because I don't want to bring other people down. And that's something that I have to deal with.
And remember
But
to check on your happy friends, them the worst ones. Watch them. The ones always happy, be careful with them.
I can be that happy friend.
When
We-
I'm
Like,
sad,
I really
I'm sad.
appreciate sharing your stories, because this will make me understand and share with my family about my niece, because I am very concerned about her right now. And I think it is going to be a while before they get her on the right medication. So thank you, ladies.
Mm.
Yeah.
When I'm sad, I don't know how to shut up.
Aundria.
I don't know what that's in.
I got diarrhea of the mouth too.
All right, we'll share some info. Let's see, is that the right one?
So 10 ways to take action for mental well-being. Start the conversation. That's what we're doing here. We're talking about it. We're sharing our stories with the world. Share trusted resources. So if you know about hotlines, if you see someone in trouble, offer them resources that you know of. Trusted resources is important. Show your support. So you'll notice that some of us are wearing green today. That is the color for World Mental Health Day. So that's another way to show support. And take a mental health break. I know August is going to talk about this later in August Corner, but self-care is really important. Whether that's exercising, meditation, taking a walk, feeling the ground beneath your feet, all of that can help reset your mind and make you feel a little bit better. And then get involved. Do activities that help support people's well-being. Next one.
Next.
And then raise your voice. So this is really important. We're talking about what the administration is doing to these mental health cuts. We need to fight back. We need to tell people what's going on so that others will fight back and advocate for money towards mental health programs and mental health educators, etc. And then check in with someone. Like Anitra said, check in on those happy people, because like I said, you never know what people are going through. And sometimes people with the biggest smile on their faces have some really deep pain. Number 8, you can also donate or volunteer to organizations that provide mental health support. You can educate yourself. So if you have people in your life who struggle with mental illness and it's something that you're unfamiliar with, please educate yourself so that you can help take the stigma away. And then lastly, celebrate progress, because that is very important. So thank you all for sharing and listening. I appreciate it.
Thank you, Keisha.
Thank you, Keisha. Such an important topic. And more so now because of what's happening. So that's mental health. We're going to talk about health. And Maureen has this topic. Before I go to Maureen, this was a really interesting commentary in response to J.D. Vance's ludicrous comments about Medicaid, being given to immigrants, right? And how, why are we giving, Democrats want to give all their money from Medicaid to support immigrants or people who are undocumented. So I found, one of my friends shared this with me, and I thought it was really, really great piece on this.
I can't stop thinking about. Take a listen.
Emergency room waiting is an illegal alien, very often a person who can't even speak English. Why do those people get healthcare benefits at hospitals paid for by American citizens?
So, JD, I have some news for you. Physicians, me and all my physician colleagues all across this country, we're not like you. We chose a profession where we wake up every day to help people. We're not self-serving. Nothing you can say or do is ever going to stop one of my physician colleagues from providing care to a sick or injured person who shows up at the doorsteps of an emergency department. Also, side note, emergency departments are legally required to provide emergency care to anyone who shows up at their doors because of a law called EMTALA, which was signed into law under Ronald Reagan's presidency. Ronald Reagan signed this compassionate bill, which legally requires emergency departments to provide emergency care to anyone, regardless of their insurance status, regardless of their immigration status. And I dare you to try to stand in the way of an emergency medicine physician and a sick or injured patient. We're not like you. This isn't about us. This is about our patients. And I can see how it's hard for you to imagine that there's a whole profession out there that wakes up every day to help people, regardless of what it does to personally benefit us. Anyways, let's elect more doctors to the House and the Senate and state houses all across this country. You can start with me. I'm going to send Lindsey Graham home in about 13 months. Have a lovely evening.
Yes.
Hope she does.
Yes.
She wins.
And
That
so
was great. I love that.
thinking about
My mouse.
That was, yeah.
Right on. I love it.
Well,
Lindsey Graham needs to go.
oh,
Anyway,
he does. He does.
he's needed to go for a long time.
Take Abbott with him.
My fear is that if he writes any kind of executive orders about that, because they're already dabbling in it, that regardless of what the doctors or the nurses want, it's all based on what the facility wants, because that's their stuff. So if they tell us we can't bring them in, you can bring them in, but you can't use our equipment. I'm just saying, it all sounds good, but these people are complying, and it makes me very, very nervous.
I doubt that.
I didn't mean to bring everybody down.
No, I doubt that hospitals are going to do that, because the minute you do that, you're going to get hit with lawsuits left and right.
You're right.
And it's going to bankrupt you anyway. So rather than, I mean, what are they going to do? It's a law that says that you must provide care. And so if his executive orders are not laws, now, unless they're going to start.
But we following them, so it's
agents
just as good as one. It
you know,
sounds good.
Yeah, but I don't think it's going to happen, because hospitals do not want to lose their accreditations. They do, and they don't want to be hit with lawsuits. Which
I hear what you're saying, but besides the order, they have legal rights not to.
Doesn't matter. No, they do not have legal rights. An executive order is not a law. An executive order
They
is
ain't
not
supposed to be in the streets with our military, but they are.
People are complying, but it's illegal. And I'm telling you right now.
I hear what you're saying, but they ain't stopping them nothing.
No.
I understand what both of you guys.
Profits over patients.
I understand both of your points, but I do agree with Anitra that even that executive orders aren't law. And I agree that hospitals are concerned about lawsuits. However, we don't live in a world of laws anymore. We live in a world where people either obey Trump or they resist Trump. And unfortunately, the pattern that is being shown to us that people obey, especially people, corporations, executives, CEOs. So I can see it going both ways simultaneously. And then hopefully over time, it would go back to the laws.
Right.
Hopefully. Okay, so let's, those are all great points, everybody. This is such important topics, such important. So I know, Maureen, you wanted to just summarize a little bit about what what you
Yeah.
found?
These are just stats, but I think they're important right now. This is a good segue into this because this is what we're all worried about, is the loss of funding. And, you know, the Republicans' wonderful, beautiful Megabill. And right now, that's what the Democrats are fighting. That's why we're closed down, so that they do not make these major cuts to our health care and Medicare. I'm sorry, Medicaid. Well, it could be Medicare too. The law, this is kind of small, but I'll do my best here. The law cuts 1.1 million from Medicaid, 1.1 billion. Oh, I'm sorry, trillion. I didn't even know there was such thing as trillion from Medicaid and ACA Marketplace, according to the Congressional Budget Office, CBO. I'm not going to read all of this. I think it's a good article if anybody who wants to take a look at it later on. But under, as we know, the Republican health plan, roughly 15 million people will lose their coverage and become uninsured by 2034 because of the Medicaid and ACA Marketplace cuts in the Republican Megabill. I just don't understand them. I just shake my head. What are they thinking about? So happy that your families are all nice and safe, you billionaires, Trump and your administration. Can't you think about all those little children and those people with major disabilities, those people especially on Medicaid? No conscience, I guess. I'm appalled by the whole thing. We can go on to the next one. Kim?
Yeah, it's page 2.
I didn't. Okay. Once again, roughly 15 million people will lose coverage and become uninsured under the Republican health agenda. And it's broken down here. Medicaid cuts in the Republican Megabill is 7.5 million. ACA Marketplace cuts in the Megabill about 3 million. Failing to extend enhancements, PTC enhancements, 4.2 million. So this, and also Medicare cuts and interactions between policies in the Megabill, total roughly 15 million. And I'm sorry, I'm having a little hard time. It's small writing. But as you could tell, irregardless, it's a lot of money they want to take out in that bill. And we can go on to the next one.
Okay.
Oh, okay. And I can't believe they're touching both Medicaid and the ACA Marketplace coverage, because this is for people who don't have health care insurance through their employers, or they don't have a job where they have, it's really complicated too. There's also the problem with, even if you do get ACA, it's already a bit expensive, but at least it helps out. Medicaid, there's special provisions to Medicaid before you get that. I think even if we keep all of this, we still need improvements in our healthcare system, but certainly don't take all these good programs away. Then we can go to the next one.
That's it.
The next one, okay.
No,
Yeah, I just want to share. I think it's, I just think of my own family. I have a nephew who doesn't have any health care and depends on these programs, and has a little boy who has autism, who's 7 years old. And there's special programs, but they cost money, and I hope there's not cuts to them that they are taking advantage of for this little guy. I know Momo told me about the regional centers, and I wanted to share with you, Momo, that they finally have contacted the regional center in their area, and they are getting the best help from them. They didn't get it from the school system. I'm not saying all school systems are like that, but it wasn't working out. But we all hold our breath. How many of these good programs are going to be cut along the way that are so important to our families, to our friends, and to those people that are out there suffering right now? And I get very emotional about this. It's breaking my heart. How much can we all take? What they keep on taking, and they're not giving us anything. And we know there's a lot of people suffering already through all of this. Anyway, I leave it to all of you, but I think that was this has to do with mental health, doesn't it? This is going to cause more mental health. Yeah. What's wrong with you guys? Huh? Wake up.
That's
or
right.
leave. Or leave the presidency and leave the cabinet and get out of there. Anyway.
It's horrible. It's absolutely horrible.
It is.
And that's what the Democrats are fighting for right now with the shutdown.
Yeah, they are. I hope they get it.
I hope they do. The problem is the other part of it is in the big beautiful bill, and ain't nothing we can do about it. It's already in there. So if they do this one now, this right here on top of that, it's going to be
devastating.
I just pray that this doesn't go through. It can't.
I just don't understand playing around with people's health. Like,
they're trying to kill people.
Yeah, and I think Aundria said it before. Like, they want everybody dead.
That's the motive, to thin out the herd. They want 100 and some thousand people, and they got to kill 200 million of us to get there. Take away their food and their health care, and then keep them subjugated where they can't learn. I remember that before. It happened some other time.
Have you seen Gaza? Have you seen pictures recently of Gaza?
Yeah, it's so sad.
And he wants it to be the new Riviera at the risk of everybody's life. They don't care.
It's sick.
I don't like to say that. I don't take pleasure in that.
I don't either.
But earlier this week, we talked about mental health. You know, I had an episode of something this week that I talked to y'all about, and I felt like I was being discriminated on a big scale. And I was, but it hurt me. I wasn't angry like I thought I would be. I mean, I cried. I had to call somebody, and I was weeping. And then they started crying because I was so sad. And these little things hurt, and then you see other people suffering, and older people that can't afford this or that because now their light bill is, you know, I get $2,300 and I own my house, but I can't afford the utilities. So I have to leave it because now I don't have any lights or hot water. Stuff like that, I'm seeing that a lot, and this is terrible.
Absolutely. I want to comment, Jazzy.
And 988, if anybody's in trouble or feeling the least bit of suicidal, you can call 988 for help.
Right. Thank you, Anitra. Again, I want to respond to Jazzy. Stephen Miller is as crazy or crazier than the rest of them. That man is absolutely nuts.
Oh, yeah.
Stephen Miller wants this to be 1930s Germany.
Yeah.
That's what he wants.
They're not nuts. They're evil.
They're evil. Stephen Miller is something that makes me actually believe in reincarnation. That he is a reincarnation.
He's a minion for the devil, at least.
One of a Nazi from Germany.
Nazi? I mean, yeah, you're right. You're right.
Yeah. That's how they think.
Yeah.
And he gets so animated with it, and like he's almost salivating and spitting. It's like,
and they think they're gonna live forever. That's one thing I'm amazed about.
we can use a be cool. That's what I call it. We just say whatever it is, be cool.
They seem like they think they're not gonna die. They're
well,
not.
Either they're not going to die or they're not going to leave office. And
I don't understand.
What?
Did she say
I just don't understand how people are saying this in religious and they're putting God involved in this stuff. And it's the antithesis of what the Bible says to do. And yet they keep standing on the Bible, and I don't get that.
That's
You
how
know,
they
I
said
have
bottom
to say,
30%.
this truly, I always hate to say that. I never thought I would, but it is like Nazism.
It is.
I mean, and fascism.
That's anti-fascist, Antifa. That's what that stands for, and I'm anti-fascist. So,
Or
So you all Antifa.
Antifa.
Antifa, my
Antifa.
Antifa.
We found it.
My big sister name.
that's not the same thing. I'm saying that to the Antifa.
We have to pull that up. There we go. But okay, great conversation, you guys. I knew we were gonna have a lot. Just to let you know, internet is wonky here right now. Very wonky.
I went out.
So it's not like my internet at home where I have I have fire hose internet at home. Today it's little internet bandwidth. So well, bear with me on that. So let's switch out to Katie, because it's still an extension of healthcare, right, Katie? When we talk about the next night.
Yeah. So I'm literally using my own video that I did last night to help me, because it just explains all of the craziness with RFK Jr. And we have to stop listening to him. I don't think any of us do, but the country itself just has to stop listening to him, because he is such a quack that he makes ducks look bad. Like, let's be real.
People have whooping cough now.
Yeah, I have different timestamps, so I'll start this one and just tell me when you want to stop and go to the next one. Okay?
Yeah.
All right.
Sounds good.
All right. Oops. Let me make sure we have sound.
Because this morning before I came in here, somebody showed me a TikTok video of a pregnant woman at 8 months pregnant. She is an associate professor at the Columbia Medical School. And she is saying F Trump and gobbling Tylenol with her baby in her placenta. And
okay, first of all,
right there, stop. Oh,
yeah. If this lady is a
keep going a little bit.
Keep going. Okay.
Professor at Columbia, I highly doubt it's real Tylenol that she is gobbling down, Mr. Like, come on, people. And so what if she says fuck Trump?
Okay,
Lots
you can
of
stop
us
it.
say it. Fuck Trump.
Okay.
Yeah, I didn't even realize he said the baby in the placenta the first time either, because he just says so much crazy shit that it's like. And why are you taking health advice as the head of Health and Human Services? Why are you taking advice from TikTok? Like I just don't. This is a man who swam in a literal sewer with his family. Like, why are people taking any of this seriously? He's not a doctor. I don't understand it. And I think you all can agree with me that there's no way that a Columbia professor was, dousing Tylenol like that her 8th month, like shot glasses. Like, let's be real. Jazzy said that worm in his head is running the show. Yes, it is. So we could move on.
Okay, so I'm at 229.
It's not just positive that cause autism. It is so suggestive that anybody who takes this stuff during pregnancy, unless they have to, is irresponsible. There are 15 rodent studies, and every one of them shows if you give it to the mother, the babies, and particularly the male babies, have profound neurological and behavioral changes. There
Rats
you can stop it.
Are not people.
There's a study from Johns Hopkins on
You can pause it.
They divided.
Yeah, I just said that.
But he said 15.
But, oh my God. Like, rats are not people.
It's not enough.
And it's just.
And it's probably not peer reviewed.
No.
No,
and then
it's not peer reviewed. 15 rats. You got about 2,000 rats.
And then after this, he tries to say that a John Hopkins study found something with, you know, the Tylenol and autism and stuff. And like, I highly doubt that John Hopkins would ever publish anything like that. He's just like, these people are at the point now where they're just throwing out names that people think are like credible because they know nobody's going to do actual research and look it up.
Well,
Like
they
John
spent
Hopkins.
17 trillion doing the research. They're gonna get some more.
No, they did.
Trillion billion.
Well, he also said that circumcising boys causes autism.
Oh yeah, I'm getting there. I think I have. I think, is this the last one, Kim?
This is 351, third.
Okay, there's another one.
Third
I think.
one. Third to
Okay.
the last.
Yeah.
Autism. Cuba has the highest, the lowest level in the world of acetaminophen use, and it has the lowest autism rate in the world. Oh, this is not dispositive. It is not a proof. We're doing the studies to make the proof. But in the meantime, the precautionary.
They've been doing studies for hundreds of years.
You could pause it.
Okay.
Yeah, you could. Yeah, I love how he's saying we're doing the studies to make it proof. Like that. What? And Cuba, as I said, like Cuba, the reason the autism rate is lower and Tylenol rate or whatever is lower, Cuba was for a long time a fascist country and still is trying to recover and have the resources that countries like ours have. That's why. It's not because of Tylenol.
Well, you can't just deduce that is the reason. You have to look into other environmental factors. And I could be on a research team because I trained into it. So
well,
I understand. It's just what he's trying to do is not based on anything. This research is just starting.
Mm-hmm. I think this last one is about the young boys.
Okay.
One in every 19 children, one in every 12.5 boys. This is a national security issue. There is nothing more important, and I'm grateful to you, Mr. President, because you know the flack that you take for.
Oh yeah, so you can pause it.
Did he say?
He literally says that autism is a national security alert in young boys. Does he not realize how dangerous that is? He's saying stuff like it's a national security alert, and he's literally treating autism like a death sentence.
I'm sorry, is he still on heroin? Because what the fuck is he talking about?
Right?
His brain.
I am so grateful I live in Pennsylvania because, like, they're just saying F everything RFK Jr. says. But
worm is still in his brain eating it. I don't care what they say.
That worm is having a picnic up there.
The problem is that the people who are buying it, and like Florida, we're gonna say the whole state, those people don't stay there. They go to New York and San Diego, and that's the problem. Now we all gonna have whooping cough because they want to play.
Stay home, stay in Florida.
And there was another part of that clip where Trump goes off talking about how I'm just gonna use this as an example. A glass of water like this is how big the shots are that get put into babies. Are you just that no?
Right. No.
Well, the other day he thought habeas corpus was a person, so anything could be possible.
I mean, I'm somebody who's had like countless specialists for different health things and in and out of doctor's offices for most of my life. And like, I am here because of modern medicine. My daughter is here because of modern medicine. And the way that he is just playing with all of this, it's so dangerous. And it gives even more stigma to these crazy conspiracy theorists that are already out there. And I am just, God, we have to get them out. This has to stop.
Yeah. A couple things. I did some research on the whole Tylenol thing, and Sweden actually did an extensive research on it and found no correlation. So we've got correlation and causation. There's not even a correlation that they found between Tylenol and autism. They never talked about that study.
at the end of that video, I think I look up about 3 or 4 different major things, like the American Association for Pediatrics, the American Association for Obstetricians and Gynecologists, and like even Tylenol itself made multiple statements, but they don't care. And it took me like 5 minutes to research that.
Yeah,
They don't
exactly.
care.
I went to give one of the patients some Tylenol the other day, and they was like, Tylenol? I was like, yeah, it's okay. I was like, just take it. But they were skeptical at first. And so that it was a young person, but I said that little twinge of him saying that is having an impact already.
Yeah. Well, when it does come to vaccines, though, I will, I am curious, because when I was a baby, our vaccine list was like this, right? When my kids were babies, their vaccine list was maybe like this. I looked up the vaccine list because I have a new grandbaby. It's like this. And they're giving so many vaccines at once to small babies. And I don't think that's a good thing. I'm not a doctor, but I don't know that putting that much into a small baby is right.
Did you talk to your doctor?
And we spread them out. I mean, we're going to talk to the pediatrician, but that's my sense.
Well, I know they spread them out. There's a protocol to give.
There is, because with my daughter, I think the most she's ever gotten at a time was 4 at a time. And that was, they never put them all like in the same spot either.
Mm-hmm.
Like they would do one.
Well, they're not going to put them all in the same spot because of problems, but this is the thing, and I don't mean to be Debbie Downer all the time, but they still going into the same. When they get in there, they all going to be together.
I think it's mostly, well, no, I think it's mostly for like pain.
Yes.
And
exactly.
like
and
inflammation.
And bruising and
yeah.
the adipose tissue and stuff.
But, and then some of the shots too, I know for her, like, she'll get multiple ones for different things. So the first dose is usually a lot heavier than like the next ones for immunity and stuff. But if you have the proper pediatricians, they'll have a good schedule, so it's not so many at once.
Yeah, and that's what we're going to look into. And I know the vaccine technology is different today than when I was a baby, so I do know that. And we have to
And now with more people in the world, there's lots more diseases popping up too, because
and they mutate and change, so they got to mix all that into that one. But then you think something's eradicated, and here we go again.
Yeah, you also have to weigh the risk of getting the disease versus getting vaccinated, because what's polio? That was terrible.
Yeah, some people gonna start getting it again.
And polio,
leprosy and whatnot.
People need to look at photos of iron lungs.
You say you
Maybe
got
that'll scare them.
They back in use again.
You know who
Hyperbaric
doesn't
chambers.
complain about vaccinations? People in developing countries, because they know what it's like. They see the repercussions of not having vaccinations.
Yeah.
Like when we cut down AICD, or ain't that called?
And people of a certain age know what the results of having vaccines help them not lose family members. Like my grandfather, he lost a lot of siblings because they didn't have vaccinations. So I think Americans are too privileged and they don't know history. And so they take things for granted.
They took the books away. They took the books away. They don't want to read. They want them to be stupid.
I think people in the United States too just want to remain ignorant and think that their way is the right way, even though it's not.
Why people don't like to read no more?
Because they can't.
No.
Yes.
Well, not all white people.
No. I read.
Not all white people.
You'll be amazed at how much people, some of them just can't.
People.
I was gonna say I love reading.
They graduating, but they can't read.
No, I said why people. I didn't say why people.
white people do. I'm sorry.
Not white people, white people.
Why?
Oh,
Yeah, I didn't even say
Aundria, you are funny.
That's funny.
I was wondering. I was like, did I miss it?
Now, Mike, did I miss something? We needed
I
to be
just want to share an aside. I did
It's
get
like the video where the guy asks, "Is there a black person here?" And they think he's getting smart, and he really looking for a black purse in there. And she said, "Hold my spritzer." She was about to give him. He was like, "Oh, there it is. Thanks."
just a PSA. I did get my COVID and flu shot, so you can get your COVID shot. I had to sign a waiver that said I had one of the conditions, and hey, depression is on there. So
And I'm over the age, so I can get mine. But I got mine in June, so I can't get another one, I think, until probably November.
I heard that flu season is going to be bad this year.
Oh, yeah.
I had to get a flu,
So I've
but I
already
won't
got
get the COVID again.
If I'm in an area with like more than 10 people, I've got my mask ready.
Flu, get the flu.
So, guys, we have others to go, so let's go ahead. We're at the bottom of the hour. Thank you for sticking with us.
Flu season is very important.
Could
If you're
you
older,
hit the
take the
like
COVID
or
shot.
subscribe, please? Hit like or subscribe. Hit some hearts, and make sure that we're able to hear your reactions.
Absolutely. So we're going to turn it over to Miss Momo, because we're going to talk about fighting back on all this crap, right? So Mo, I have Letitia James queued up. I don't know if you want to do that one first, but you go ahead and lead into this and let me know what you want to do.
That is fine to lead with that. Any of the things that I showed you could really be shown in any order. I will preamble this with saying, though, people are fighting tyranny. They're fighting this regime in any way that they can. Some people are putting their bodies on the line. Some people are using their wallets. Some people are just standing 10 toes down on whatever it is that they believe, and they will not be moved. I guess you could say I'm over the dialogue that we seem to have consistently, asking the question, why aren't people doing this? Or why aren't people doing that? What you do in this moment is a personal decision. You have to decide as an individual how much you're willing to sacrifice, what you're willing to put on the line. And I will just say this in the spirit of Hakeem Jeffries when he told him, don't come at me unless I send for you. I'm going to tell you, don't come at me with criticism unless you're going to pull a solution out your back pocket. Do not criticize people in this moment. We need to be lifting each other up and encouraging one another. No matter how you want to get in this fight, welcome it. But do not put people down for what they are doing. And I'm over that. I'm really over it. And there's so much that we can't see because mainstream media is not showing it. There are people out on the streets every single day. There are protests going on every single day. This No Kings thing is a very, very important one coming up, I believe. I believe it's going to be the most massive protest probably in our history. No one should foo-foo that away and say that it doesn't matter or it doesn't count or we shouldn't do it because it's not going to make a difference. Everything you do can make a difference, whether it's a small one or a big one. But I'm over it. I'm over it. And these are just some examples that I found and I sent to Kim of people that are fighting, people that are standing their ground. And I just believe as a community, we need to lift each other up.
Ready?
Roll it.
All righty.
This is nothing more than a continuation of the president's desperate weaponization of our justice system. He is forcing federal law enforcement agencies to do his bidding, all because I did my job as the New York State Attorney General. These charges are baseless, and the president's own public statements make clear that his only goal is political retribution at any cost. The president's actions are a grave violation of our constitutional order and have drawn sharp criticism from members of both parties. His decision to fire a United States attorney who refused to bring charges against me and replace them with someone who is blindly loyal not to the law, but to the president is antithetical to the bedrock principles of our country. This is the time for leaders on both sides of the aisle to speak out against this blatant perversion of our system of justice. I stand strongly behind my office's litigation against the Trump Organization. We conducted a 2-year investigation based on the facts and evidence, not politics. Judges have upheld the trial court's finding that Donald Trump, his company, and his 2 sons are liable for fraud. I'm a proud woman of faith, and I know that faith and fear cannot share the same space. And so today, I'm not fearful. I'm fearless. And as my faith teaches me, no weapon formed against me shall prosper. We will fight these baseless charges aggressively, and my office will continue to fiercely protect New Yorkers and their rights. And I will continue to do my job.
Thank you, Kim.
Yeah, that's powerful.
Yeah, that was very powerful. It gave me goosebumps when I saw her. But I'm gonna, you can run any of the other videos, but I'd like to just open it up for discussion. Anybody have any comments or?
Go ahead while I pull these up.
I think I said this on Dawn's show yesterday when I was on for like 5 seconds. If there's one thing that Trump is afraid of, it's a strong Black woman. Because he was afraid of Kamala, and now he picked the wrong women to mess with. I'm just saying. And
The
she's
thing
not
is,
going to
he
back
don't even
down.
care if they go to jail.
He don't like Auntie Maxine either, and it's hard to come behind Letitia. She says it so eloquently.
He just wants to. He wants to embarrass them, make them perp walk, do all this stuff. He don't care if they get convicted or whatever. He's so special.
Special's being too nice.
Yeah.
Yeah. So I have Pritzker. Did you want to show that? I have that one next.
Yeah.
As well as I do, the President of the United States in the last 24 hours called for you to be imprisoned. I want to give you an opportunity to see your reaction on social media, but I want to hear what you have to say back to the President of the United States.
Well, let's start with the idea that this is a convicted felon. I mean, think about that. Who is threatening to jail me. I got to say, this guy's unhinged. He's insecure. He's a wannabe dictator. And there's one thing I really want to say to Donald Trump. If you come for my people, you come through me. So come and get me.
You know as well as I do, the President of the United States in the last...
Yeah, I love the visual though. Too bad it was freezing. At least it was freezing for me. I don't know if it was freezing for everyone else, but when he put his hands up like this and said, "Come and get me," yeah, I just love it. I mean, there's fighting. There's fight out there. There's fight, whether it be in local leaders. There may not be a whole heck of a lot. There's a disappointment in me, in our highest leadership in Washington, D.C., but local leaders and citizens themselves are rising to the occasion. And that is why I'm just so adamant against the consistent discouragement or the consistent complaining about what's going on. Do the research. There's stuff going on all over the place.
We have Newsom next.
Today in Chicago, I don't know if you guys saw everything that was going on. It was pretty amazing. People speaking out. So,
Yeah. And yesterday they had a live that was going on in Chicago as well. Here's Newsom.
Michigan Avenue.
Oh, no sound.
No sound.
Oh, here it is.
Educated. Get your hands off these poor people who are just trying to live their lives, man. Trying to live their lives, paying their taxes. Been here 10 years. The fear, the horror. The hell is this guy? Come after me, arrest me. Let's just get it over with. Tough guy. You know, I don't give a damn. But I care about my community. I care about this community. The hell are they doing? These guys need to grow up. They need to stop. And we need to push back. And I'm sorry to be so clear, but that kind of bloviating is exhausting. So, Tom, arrest me. Let's go.
The home and the borders are
fighting.
Yeah.
And then the last one was the protest. So,
yeah. The stuff going on in Chicago. There's a lot going on in Chicago right now.
I love the costumes. Is that
Oh
Portland?
my gosh. Oh my
yeah,
gosh.
there was after like do.
Yes.
I like the giant chicken.
Yeah, I'm like,
I'm gonna go rent one, I think. All right, what's going on here?
This was an impromptu protest where they got thousands of people together. This was like an impromptu thing that sort of happened in Chicago. It was response, I think, to probably a video somebody saw of an ICE raid or something going on. But I mean, literally, these people have a network and they're connected. And you put out one text or one tweet or something like that, and the next thing you know, you've got hundreds and thousands of people all around you. And so that's why I say we cannot give up the fight. The fight is going on, even if it's not being televised. It's happening.
100%. And we're going to talk about No Kings towards the end here. So
yeah.
Was that it, Mo?
Yeah, that's it. That's it. It was more a rant than anything else. I just needed to get that off my chest because it's just like
You go, girl.
Good job, Lobo. Excellent.
Yeah. Thank you.
I wanted to add that New York has been protesting regularly every week. Like they are out in the streets. I'm proud of my city, and it just doesn't get televised, but we have been protesting.
Mm-hmm. Yeah, it's happening.
I'm making my No Kings protest sign now. I went to the Lowe's and got me a length of wood so I can. I said no. Trump must go. Trump must go.
All right. So next on our agenda is Miss Aundria, and I'm going to turn it over to Aundria and August to talk about this one. Aundria?
Well, first of all, before the video plays, I wanted to say, you know, we were brought to this country a long time ago. We didn't know what life was going to be like. We've forgotten all of our history. We don't know what our traditions are. And we did all of this for nothing. So I think this says it well. And, you know, like, comment, and share. I'm ready, August.
You're racist. How'd you get in here? Door was open.
Let's get physical.
I'm so sick of people calling me a racist. How'd you get in here? Door was open. All you liberals think you can assume that I'm racist just because I voted for Trump. I believe in conservative values, stronger borders, protecting jobs, less government. Does that make me a bigot? Okay, let's just stick with the racist part. Why don't you want to be called racist? Because I'm not a racist. Okay, so you agree that racism is bad? Duh. Okay, so here's the problem. When candidates draw in people like white supremacists and literal Nazis, that's not just a coincidence. It means those people feel safe under the same banner. And I don't think that's something you can just ignore. Okay, but I have no control over who somebody else votes for. I just vote based on policy. Sure, but politics has never been just about policies. It's about values and policies that uphold those values. So when a political party openly invites hate and you don't speak up to say, hey, this is wrong, then you're actually helping to normalize it. Yeah, so you want me to abandon my beliefs because some awful people vote for the same candidate. Listen, I'm not going to tell you what to do. But I can tell you that voting is always about prioritizing your beliefs. I don't think you're ever going to find a candidate that you 100% agree with on absolutely everything, but we all choose what we're willing to overlook. By voting for him, you've made it clear to all of us that you are willing to overlook overt racism in favor of what you see as economic advantages for yourself. Shoot. The door just unlocked, or did you do kind of like a Kramer thing? No, it was kind of a Kramer thing. Huh.
Okay.
That was good.
And it's another part to that video as well that speaks on how white people created their wealth on the backs of Black people, and that we never receive reparations for all the things we've done. And every time it was time for us to build our community and we start being profitable, they would burn down our communities, or they would lynch the people in our communities, or they would drag them down the street behind a truck, whether we wanted to be or not. So we are still seeking reparations, and this is not fair. He's taken all of this money. He's taken billions and billions of dollars, and no person is safe. Nobody is safe. Only that 1% right now is safe. So what I would say is stay prayed up.
Absolutely.
She's really good too. I follow her on Instagram. She does really great videos.
Oh, she does.
Yes, I enjoy listening to her.
Yeah, I'll have to look at her. Thank
What
you,
was her-
Aundria.
what was her
Go
screen
ahead.
name?
Go ahead, Keish.
What's her screen name?
I'll find it. I'll put it in the chat.
All right, thanks.
Her screen name is Anna Connolly.
Oh, okay.
Thank you.
Of
So
course.
if you want to see her, it's the real REEL Anna Connolly.
Yeah.
Thank you.
All right. Hey,
It's
welcome
time.
everybody. It's my time again. It's August Corner. I know we've been hitting you with a lot of facts, but guess what? It is all true. Each and every one of these individual lovely ladies take the time out and do their homework. So please note, you're getting all the facts and you're getting truth and candor. So today we're going to talk about, we're going to Oklahoma. Oklahoma begins full-scale investigation. Guess who we're looking for today? It is all about Ryan Walters. Do you guys know who Ryan Walters is? You remember they wanted to put prayer into the schools. He was the superintendent. Yeah. He was doing some shady stuff like they all do. Allegedly, I must say, until he's convicted. So here it is. He hired somebody, giving them $150,000, and they only showed up twice, but got paid $150,000. And another thing that he was doing, something about some $50K that he put away for these books and so it's a whole lot of mess going on in Oklahoma. So stay tuned. It's more to come. Another thing I want you guys to be aware of from the August Corner is lien. If you have a home, please check your deeds. Please check and make sure there are no liens on your home, because the new trend is people are going to get quick claim deeds on your house, or they're going and put liens on your home. How they're doing it is someone comes and pretends to do work at your house. You might even just went out there and got an estimate. Guess what they do? They go and file it and say you didn't pay them for it. So just be careful, guys, because it is true. They have thousands of people in the New York City area that they had to put on hold from a lien being on their homes. Check your deeds. Check your quick claim. More to come. I'm going to give you some more information later. In the TSA world, we're talking about shutdown. So what TSA is now doing, they're checking your phones. So before you make that trip, please either turn off your phone, don't use your phone, or prepare your phone for travel, because they are looking into your phones. And if they see anything on there that they don't like, I can't even say that the administration don't like, what they don't like, they will hold you in custody. Now, if TSA asks you, please, can I see your phone? You do have that right to nicely say, I'm sorry, at this time, no. However, if Custom Border Patrol come and ask you for your phone, you better give it up, and you got to ask them for, you would like to see your lawyer. So just know your rights, know what you can do. But before all of that, if you know you're planning a trip in December, hey, you might want to back up your phone, send it out, and just put it back to regular settings. When you come back from your trip, just put it back to your personal information. Just be careful out there when you're traveling. And last but not least, I'm going to talk about self-care. It's been a heavy night. So with self-care, I just want you to do a couple of things when you're feeling heavy. Get a warm towel, put it on your face, sit back, and just open the window and listen to outside. If you're in a crime zone, close the window and try to put on some nice music. But please, self-care. Another thing you can do, get a full mask. Give yourself a full mask. Just put on a mask, because then you're going to take that warm towel and you're going to take that mask back off. But any way you do it, please, self-care. Another tip, stop and try to see if you can get a bowl of rice. Put your hands in the rice and just work it. You'll be surprised how it will massage your hands. If you don't have rice, you can still use that same rice, wash it good, and you can steam it up and have it for dinner, okay? You wash your hands before you put your hand in the rice, and then you wash your hand and the rice after the fact. But you can use rice for self-care, just to get some of that aggravation, some of that annoyance out of it. Another way to do it while you're in the shower, just let that water run through your hair. Just let the water drizzle on you, because let me tell you, sometimes when you just need to release that chat, you can have a great cry. The best place to cry is in the shower. Just let it go. Let it drizzle down you. And as I close with this, know who you are. Love your body. Love your hands. And don't forget about those toes. And make sure you go out there and shop for your gas mask. Make sure you go out there and shop. If you're going out for the 18th, get your gas mask. Make sure you have a mask on. Put on some extra padding, because it will be cool. And you want to make sure if anything hits you, you're covered. We love you here at We the People Unite. Back over to you, Kim.
Great. Thank you from August Corner. Great, great advice. Highly recommend it, because we have big No Kings protest coming up on the 18th. And I want to just show you a couple things. I think I had the website. I lost it. If you go to the website for the No Kings protest, I had it up here. There are some calls that you can be on to listen in, and they tell you about safety, how to be safe at these protests. And that's really, really important. So go to nokings.org. Find a location near you if you can go out and protest. And remember, here on the 18th, we're going to be broadcasting live for those of us who are going to be out and about. So tune in here if you're not going to a protest. But please, we need to make this the biggest one that the country has ever seen, because that's what's at stake right now. Two things before we head off. I know we're running late, but please, please tune in. Next Tuesday, we have the premiere of Here's the Thing with Keisha. So next Tuesday, 7:30 Eastern, 4:30 Pacific, please tune in. This is going to be a great, great show. So I want to give that a plug. And then one more thing to kind of bookend what we've been talking about as far as mental health. One of the things that I talk a lot about is psychological warfare. And so we're living through one of the greatest psychological operations in modern history. And most people don't even know it, because every headline, every viral post, every outrage cycle is designed to trigger emotion before reason. So fear keeps us compliant. Anger keeps us divided. The antidote is awareness. So when you feel that emotional pull, you have to pause, breathe, ask, who benefits if I react this way? And that single question breaks the spell. So please look past the sound bites, because psychological warfare only works when we surrender our attention to it. Don't feed the chaos, reclaim your mind, and for your own mental health, obviously, but for also the health of the nation. So thank you, everybody, for joining us here. It's been an engaging conversation. Some of it has been difficult, but I appreciate you so much. If everybody hits the, yes, Anitra, hits the like and subscribe. And again, join us next Tuesday.
Hey, Kim, can I plug my thing real quick?
Absolutely.
So in about an hour on my channel with May the Millennial Gaze, we're going to have an episode fully dedicated to mental health. So some of my friends from here will be on it, and we'll be talking, and we love people in our comments. So check out the Millennial Gaze at 10 Eastern, 7 Pacific. I don't know the other ones, but we're doing it live, so we love the interaction and stories. So hope to see you guys there.
Thank you so much. And for some reason, I cannot find my end live button. Where did it go? There it is. All right, guys. See you next week. Have a great weekend. Get out in the nature. All right. See you later.
We the people unite.